Oxygen therapy is prescribed by the primary care provider. It means it should be ordered by the physician who specifies the concentration. It means the concentration of the oxygen, method of delivery, saan ba siya ibibigay, depending on the method, and liter of flow per minute, ilang liter per minute. However, no, administering oxygen as an emergency measure, the nurse may initiate the therapy. Yun sabi ko sa inyo kanina, no? And then, contact the primary care provider. So, relating on our case study analysis a while ago, no, we have patient that has, bad condition, no, in terms of the health status, no. We have patient using accessory muscles, difficulty breathing, diminishing sound, and also bad oxygen saturation level. So in that case, it means it is an emergency situation. So kailangan natin magbigay ng initial oxygen therapy. So sabi ko sa inyo kanina, you could give actually 2 liters per minute initially via the nasal cannula. Then, immediately contact or inform the primary care provider, which is the physician or the resident doctor on duty. So, how oxygen is supplied in the healthcare facilities? Now, oxygen is supplied in two ways in healthcare facilities: by portable system, using cylinder or tanks. Yung nakikita nyo mga green tanks na may parang yung mga long cylindrical tanks in the hospital setting, or we have also those mga portable maliliit na yun tinatawag din portable systems using cylinder or tanks, or we have also the wall outlet system. The oxygen is integrated in the building structure itself, and we can find oxygen supply at the wall of the room of our client. So, portable oxygen delivery, clients who requires oxygen therapy in home may use small cylinders or of oxygen in liquid form, or an oxygen concentrator. So, portable oxygen delivery system are available to increase the client's independence. So, most likely, if, for example, in private duty nurse, meron tayong mga portable oxygen cylinder systems delivery, no, para at least they could still use oxygen if even though they are staying at their homes. But however, in the hospital setting, sometimes oxygen or yung tinatawag natin yung cylinder system, meron na siyang disadvantage. For example, if you have patient that needs high flow of oxygen, and then you need to constantly change, no, cylinders, and also it also pose risk to our client kasi, for example, if mayroong earthquakes, so pwede siya matumba ang cylinders, and also it could injure our patient in one way or another. So that's why meron tayong mga built-in o yung wall system natin. So this is the picture of our portable cylinder system. As you can see here, these are the parts of our portable cylinder system. We have the oxygen tank, no, which most likely is cylindrical itself, kaya tinatawag sa portable cylindrical system. Then we have also the regulator. Important itong regulator, guys, because our oxygen tank system, it contains high pressure of compressed oxygen. If we don't have oxygen regulator, lalabas yung mabilis yung oxygen, at it is not good for our client. Then we have also oxygen gauge. This gauge determines the pressure of oxygen inside in this tank. Take note, guys, once the oxygen is inside the tank, because it is compressed, it is in liquid form, and once the oxygen is being delivered through this system, paglalabas niya, dry oxygen, gaseous oxygen na siya. Then we have also the flow rate. Though dito natin malalaman if ilang liters per minute yung ibibigay natin. For example, 2 liters per minute, dapat yung aneroid na head naka-point siya sa 2, no? 2 liters dito. So that means that the flow of oxygen going to this system is 2 liters. Then ano ba to tawag ito, guys? Now this is the humidifier bottle. Sir, why it is needed na kailangan natin ng humidifier? Kasi oxygen in this tank is a dry oxygen, pure and dry oxygen. So if you administer that directly to the patient, it might irritate the nasal tissues or nasal mucosa. So it could injured, no? Pwede na siyang ma-irritate. So kailangan natin ng humidifier to make the dry air, no, humid. So medyo mabasa-masa siya para it doesn't irritate the nasal mucosa. Then we have also the cannula tubing. This tubing pathway, no, is the pathway of oxygen to the patient. Then this is the another close close up picture of a regulator and also gauge and regulator and also the built-in humidifier. As you can see here guys, ito yung ina-attach dito sa sa opening, no, ng oxygen tank. And make sure guys that you will not touch, no, the inner aspect of this one, because it should be kept dry and clean. Bawal yung oil dito, kasi pag may oil dyan, in the process of tightening the oxygen in attaching this one to the oxygen, pwede na siya mabuto, no, kasi meron siyang fuel. Kasi yung oxygen guys, no, it is hindi siya flammable but combustible, no, it promotes combustion. So kung oxygen lang itself, bisan pag sindihan mo na oxygen, dili na siya musiga. But if there's presence of any form of fuel, it could be an oil or alcohol or any form of it, no, or a grease. Once meron siyang heat, it will conduct fire, no, it will promote combustion, mubutog na og musiga na siya. Okay, kaya bawal ang smoking in the hospital setting because of the presence of oxygen. So as you can see here guys, meron tayong level. So dapat the level of the water, no, dapat distilled na and sterile water yung ibutang nato dire, dili kay magkuha lang kag tubig sa faucet then ibutang nimo siya dire, dili na siya pwede, ha. So mo ni ang humidifier na to make the dry oxygen wet, no, para dili siya ka-irritate sa nasal mucosa. Then this is the wall system. As you can see here guys, no, wala na siyang tank. Ang advantage of this one in terms of natural calamity just like earthquakes, walang matutumba na tank. At saka for example, if you have a patient in the ICU that needs high flow of oxygen, dili na ka magsigi og inalsahay og tangke puli-puli, and also pwede po mamatay yung patient na kung cylindrical yung gamiton because makalimtan, no, mahotdan siya og oxygen. Unlike with the wall system na daghan kaayo na siya supply of oxygen, centralized. So there's no instances na makulangan tag oxygen, unlike with the tank system. So that's why meron tayong mga wall system. But the disadvantage of this one is the portability feature na meron yung cylindrical system natin, yung portable cylindrical system. For example, if we transfer a patient from one hospital to another hospital, so kailangan natin ng cylindrical tank system. So oxygen therapy safety precaution. So for number 1, for home oxygen use or when the facility permits smoking, teach the family members and roommates to smoke only outside or in provided smoking rooms away from the client and the oxygen equipment. Remember, oxygen could catalyze catalyze combustion. So even though ano lang yan siya, cigarette smoking lang yan, once yung agipon niya, no, mabutang dito sa for example paper and then ma-expose sa oxygen, musiga gina siya. Place cautionary signs reading no smoking, oxygen is in use on the client's door, at foot or head of the bed, and on the oxygen equipment. Merong mga instances guys na may nangyari dyan in the OR setting or OR theater na nasunog yung patient, no, because of loose cautery. Yung cautery natin using of, anong tawag yun? Electric cautery. Instead of yung knife, no? Bali, current na yung mag-slice ng tissue. Ang benefit niyan, it would prevent bleeding unlike with the knife. However, nangyari doon guys, merong leak yung tank nila and then nag-spread sa room and then while doing the operation using cautery, bigla na lang nisiga ang linen. No, nasunog ang patient. So nakasuhan ang staff and admins ato. Next, instruct the client and visitors about the hazard of smoking when oxygen in use. Make sure that electric devices such as razors, hearing aids, radios, televisions, and heating pads are in good working order to prevent the occurrence of short-circuit sparks. Yun ang nangyari, merong short-circuit sparks yung sabi ko sa inyo kanina kaya nasunog. Then, avoid materials that generate static electricity such as woolen blankets and synthetic fabrics. No, cotton blankets should be used and clients and caregivers should be advised to wear cotton fabrics. Kasi yung mga wool or yung mga nylon based na mga cloth, no, it will produce static electricity, and once there's a static discharge can cause spark, and then there's a presence of oxygen, it could catalyze combustion. Avoid the use of volatile flammable materials such as oil, greases, alcohol, ethers, and acetones. Example, nail polish, because it is highly flammable, and by the presence of oxygen, it is a perfect combination for fire. Be sure that electric monitoring equipment, suction machines, and portable diagnostic machines are all electrically grounded, to prevent sparks. Make known that the location of fire extinguishers and make sure the personnel are trained in their use. So yon, ito yung dapat yung mga oxygen therapy precautions. So oxygen delivery system, ano bang mga delivery system natin? We have the low flow system and high flow system. In the low flow system, we have low flow system siya kasi it uses small bore tubing. Maliliit lang yung diameter ng tube. No, low flow administration devices include the nasal cannulas, face masks, oxygen tanks, and transtracheal catheters. So because of these types of devices, room air is also inhaled along with the supplemental oxygen. No, the fraction of inspired oxygen, or yung tinatawag abbreviated as FiO2, no, fraction of inspired oxygen yan will vary depending on the respiratory rate and tidal volume and the liter of flow. Later on, diba na-discuss na natin to, ano yung mga tidal volume, ano yung mga variations or normal variation in inhalation and expiration. In high flow system, we have only the Venturi mask with large bore. So high flow siya kasi masyadong malaki yung tube na ginagamit natin. So yung fraction of inspired oxygen inspired oxygen natin, FiO2, is mataas, no, and precise compared with the low flow system. So let's discuss first the low flow system. Now we have first the nasal cannula, this or nasal prongs. Na ito yung may parang ganito doon nilalagay dito sa nasal meatus. Advantages of this one: the most common and inexpensive device used to administer oxygen. Easy to apply and does not interfere with the client's ability to eat or talk. It also is relatively comfortable, permits some freedom of movement, and is well tolerated by the client. It delivers a relatively low concentration of oxygen, about 24% to 45% at flow rate of 2 to 6 liters per minute. However, the disadvantages of this one: it cannot give 6 liters per minute. The client tends to swallow air, and the fraction of inspired oxygen is not increased even though i-increase mo siya more than 6 liters. It means, for example, if nakakanyula yung patient, the maximum oxygen flow rate na mabibigay natin is 6 liters. More than that one, useless na siya. No? Kasi hindi mag-change yung oxygen concentration niya at saka yung oxygen, the flow of inspired oxygen hindi mag-change. So, useless kung more than 6 liters. Hanggang 6 liters lang talaga tayo. And also, inability to deliver high concentration of oxygen, no? 24 to 45% lang. If your patient need about 50% of to 100% of oxygen, definitely our nasal cannula is not intended for this use, no? That's the limitation of this one. However, the nasal cannula, nindot siya na, especially in our client kanina, no, na medyo anxious, no, kasi later on you will know what's the bakit ganun yung reaction ng patient natin using the face mask. If ganun, one of our possible intervention, aside from knowing what the reason of our client bakit frequently nire-remove niya yung face mask, one of our intervention, pwede na to siya nga i-change of nasal cannula instead, no? Para hindi siya masyadong irritating sa patient and hindi siya stress-provoking. Next, we have the types of nasal cannula. We have the nasal cannula plain, then we have also mustache reservoir nasal cannula, then we have also pendant reservoir nasal cannula. So the difference of this one, no, are as follows. We have the nasal cannula. This is the picture based normally, no, nasal cannula. Because of the design of this one, no, we need to administer this, no, using humidifier. No, pag ganito, nasal cannula, dapat merong humidifier pag plain nasal cannula. However, if we have this mustache reservoir nasal cannula, tinawag siya mustache para kasi siyang mustache, no, yung appearance niya. Reservoir kasi meron siyang reservoir dito na may pockets of air. And the good thing of this one, pwede ka na kahit hindi ka gagamit ng humidifier kasi itong reservoir, it acts as it acts as collectors of yung water, no? For example, pag inhale ka ng oxygen, pag exhale mo, nako-collect dito yung mga droplets sa air, no, na galing sa exhalation. So therefore, nagiging act as humidifier din ito. Next, we have also the pendant reservoir nasal cannula. Same with the mustache reservoir. Pwede na rin hindi tayo gagamit ng humidifier kasi magko-collect dito yung mga yung droplets o yung fluid na sa upon expiration natin. So next we have the face mask. Now face mask, this is that covers the client nose, mouth by the use of oxygen inhalation. Most masks are made of clear pliable plastic that can be modified, molded or to fit the face. Now they are held to the client's head when with elastic bands. Some have metal clips, no, dito sa ilong to bend over the bridge of the nose for snug fit. No, inhalation ports on the sides of the mask allow exhaled carbon dioxide to escape para hindi mag-accumulate. Some must have reservoir bags which provide higher oxygen concentration to the client compared with the face mask that don't have it. So face mask, the advantage of this one can deliver relatively high oxygen rate compared with nasal cannula. So, di ba kanina kung 6 liters lang tayo, hanggang 6 liters lang tayo sa nasal cannula, in this, the face mask, we could definitely deliver higher than 6 liters. For example, 10 liters of oxygen, pwede na to na siya mahatag sa patient. But the disadvantage of this one, it requires higher cost, no, because of the additional device na kailangan and difficulty in achieving proper fit. It means, unlike with nasal cannula directly sa ilong, ito face mask kasi. But difficult yan kasi yung fit niya kasi we have different contour of our face, no? So that's why because of this, no, na-decrease yung oxygen concentration niya na mabi-deliver sa patient natin. And also this one, no, poor tolerance by some client who may complain of feeling of hot or smothering or feeling of suffocated. Maybe this is one of the reason, guys, bakit yung client natin kanina sa case study natin, frequently tinatanggal niya yung face mask kasi feeling niya nasusuffocate siya, di na hinon siya kaginhawa, no, because of yung psychological attributes, no, na mabibigay ng face mask kasi para kang dinulunod, no? So this is these are the disadvantage of this one: high cost, difficulty in achieving proper fit, and also yung tolerance ng patient natin. So if that's the case, maghahanap tayo ng ibang way para ma-deliver yung oxygen sa patient. So types of face mask. We have the simple face mask. Now delivers the oxygen concentration from 40% to 60%. So take note guys, no, it has a higher concentration as compared with nasal cannula, and also in terms of the flow rates, it can deliver a much higher oxygen rate as compared with nasal cannula. Then we have also partial rebreather mask, deliver oxygen concentration about 40 to 60, about same lang sila. However, flow rates na about 6 to 100 liters per minute. Then we have also the non-rebreather mask. Because of its feature of non-rebreather, it could deliver 95 to 100% of oxygen by means of other than intubation or mechanical ventilation. And it could also give a rate of 10 to 15 liters per minute. Then we have also the Venturi mask, deliver oxygen concentration varying from, it could be set as 24%, 40%, or 50% at flow rate of 4 to 10 liters per minute. This is the only mask that can deliver accurate O2 concentration. Take note of this one, baka lalabas sa board exam, no? Kasi sa time namin lumabas to, baka sa inyo lalabas din. This is the only mask that could deliver accurate, no? The keywords here, accurate. Later on I will explain bakit accurate. So simple face mask, you can see here guys, no, ito. The simple face mask, ito dapat siya snag-fit at saka meron siyang hole dito, no, para sa pag-exhale ng air. Disadvantage lang nito guys is sometimes pag medyo gamay imuhang naong, dili ka siya mag-fit, or meron ka mga counters na dili parehas sa face mask, so lalabas yung air doon. And kung simple face mask lang guys, by the fact na pwede maghalo yung room air dito, so medyo maliit lang talaga yung concentration ng air na pwede mabigay natin. Kaya nga 40 to 60 lang yun. Then we have the partial rebreather mask. It could increase the concentration guys by having a reservoir dito. Meron siyang oxygen reservoir. So nagko-concentrate yung oxygen dito. Because of this, na meron siyang reservoir, it could increase the concentration of oxygen higher than those simple face masks. Okay? Next, we have the non-rebreather mask. Non-rebreather kasi guys, tinatawag siya non-rebreather kasi hindi nagmi-mix yung room air at saka yung oxygen na deliver natin. But the problem of this one, guys, once na maubos yung oxygen supply, mag-a-accumulate yung carbon dioxide. One way to fix that one guys, pwede na to tanggalon ng valve dire. Now we could remove the valve here para in terms in instances of, for example, naubos yung oxygen tank mo, hindi mag-a-accumulate yung carbon dioxide natin. However, if you remove the valve here, it will make the non-rebreather mask partial rebreather mask. And it would decrease the concentration of oxygen because maghahalo na yung room air natin kasi tinanggal mo nga yung valve. But on the other side, we could fix, no, or if there's a situation na there's a possibility na mauubos yung oxygen natin, so tatanggalan na lang natin dito, no, para safe sa patient kasi baka mag-a-accumulate na yung carbon dioxide, mamamatay yung patient natin. Then we have the Venturi mask, no? Take note guys, it is tagged as the only mask that could deliver accurate oxygen concentration. Bakit? Kasi meron siya mga specific diameter and color coded siya. For blue guys, it could deliver oxygen concentration of accurately as 24%. Pag blue yung ginagamit, 24%. Yung flow rate niya, 2 liters per minute. Then for example, if gagamit tayo ng white, no, 28%. Pag yellow, 35% yung mabibigay natin na oxygen. Pag red, 40%. Pag green, 60%. So this is the advantage of this one, guys. Kasi for example, if the doctor prescribe, okay, administer oxygen at 8 liters per minute at 40% concentration. So, pwede tayo magamit specific this one, no? We will use the red one, no? 8 liters at 40% oxygen concentration. So, this is the summary of our oxygen devices. We have the oxygen devices, nasal cannula, oxygen concentration that possibly delivered to our client, 24 to 45%, flow rate 2 to 6 liters per minute. Simple face mask 40 to 60 liters 60%. The flow rate is 5 to 8 liters per minute. The partial rebreather mask 40 to 60 liters per minute. The flow rate is 6 to 10 liters per minute. The non-rebreather mask, guys, we have 95% to 100%. It is about 10 to 15 liters per minute. And the Venturi mask, it has the most accurate auto concentration that we could deliver, no? And it has specific flow rate in response to the specific percentage of auto concentration. So we have other auto devices. We have the face tent. This can replace oxygen mask when masks are poorly related by the client. So aside from nasal cannula, so pwede mo gamit ng face tent. For example, sa patient na to kanina, anxious siya masyado sa face mask, so face tent. So sa face tent, less stress provoking kasi dito meron siyang malaking sa taas na hole, and it means hindi na siya feeling o parang nasusuffocate ka. Later on, ipakita ko sa inyo yung picture nito. Then face tents provide varying concentration of oxygen, for example 30 to 50%. So medyo mababa siya because meron siyang opening sa taas. Concentration of rate at 4 to 8 liters per minute. We have also tracheal catheter placed through the surgical created trachea or in the lower neck directly into the trachea. Once the tract has matured, ito yung opening or healed, the client removes and cleans the catheter 2 to 4 times per day. So oxygen applied catheter greater than 1 liters per minute should be humidified. High flow rates as much as 15 to 20 liters can be administered. Then you have also non-invasive positive pressure ventilation or NPP. Deliver oxygen under pressure through the need of invasive tubes such as endotracheal tubes or tracheostomy tube. No, condition required non-invasive ventilation include acute or chronic respiratory failure. If ever hindi na talaga gumagana yung lungs ng patient, pulmonary edema, COPD, and obstructive sleep apnea. And also yung preparation for intubation. Kailangan natin ventilate yung patient using non-invasive positive pressure. So this is the face tent. As you could see, guys, masyadong malaki yung niya, para kasi siyang tent no, na binaliktad, no? Kaya face tent ang tawag. So non-stress provoking siya kasi masyadong malaki yung opening nito. Okay? As compared with face mask. But the downside of this one, bababa yung oxygen concentration natin kasi the oxygen, the air in the room could mix the oxygen in this area, kaya bumababa yung oxygen concentration. So we have also tracheal catheter. So from the word itself, tracheal or trachea. So bubutasan yung trachea mo dito, no? And may ipapasok na tracheal tube, no? At saka doon daan yung oxygen. So most likely this is applicable for patient na merong mga injury dito sa nasal area, for example gunshot wound, burns, vehicular accident affecting the face, no, or any operation affecting the face. So nagkakaroon tayo ng trach tube. Okay, ito po yung mga patient that needs to have long term, no, artificial airway. So yon yung mga butas dito. At saka disadvantage of this one, guys, mawawalan ka ng ability to talk, no, kasi 'di ba at this level dito na nakalagay yung voice box natin. So pag nabutasan yan, it could affect the voice box. So kaya yung mga may ganito nagsasalita lang yung parang dito na kinukuha nila yung boses nila, no? Hindi na sila makakapag utter ng words, masyado parang silang robot, no, pag ganito. So the disadvantage of this one. Then we have also the non-invasive positive pressure ventilation or NPP. So, bakit siya tinatawag na positive pressure ventilation? Kasi meron siyang positive pressure that could forcefully open or dilate, no? Or inflate the lungs. So, that's why ganito. So, tight sealed siya, guys, no? Kaya ganito. Tight sealed siya. So, medyo tight. This is ginagamit sa merong anong tawag doon? Merong sleep apnea. Yung patient natin na nawawala, tumitigil sa paghinga pag natutulog. Ito yung ginagamit, no? Para still pa rin, no? Meron silang oxygen supply kahit natutulog. Ito yung full face mask, no? Tight sealed yan siya, guys, ha. Usually ito ginagamit for resuscitation, no? Non-invasive siya kasi wala kang pinapasok na tube. Okay, artificial airways. Meron tayong mga artificial airways, guys. We have the this is intended, guys, to maintain patent airway passage for clients whose airways have become or may become obstructed. No? A patent airway is necessary so that the air can flow to and from the lungs. Four more common types of airways are as follows. We have the oropharyngeal, nasopharyngeal, endotracheal, and tracheostomy. So yung tracheostomy kanina na-discuss na natin, no? Trach tube. So in the oropharyngeal, guys, meron tayong oropharyngeal. So the tube should be inserted in the oral and it could go in the pharynx. So most likely, yung mga patient na binibigyan nito, pag for example, namamaga yung oral areas, burns, ano pa, or any conditions that could alter the entry of passage of air in this area. So oropharyngeal. Then we have also nasopharyngeal. From the word itself, naso and pharynx, it means sa ilong, no? Pinapasok yung tube. So most likely, mga patient na nilalagyan nito, if for example, yung burns na inhalation, yung pag start ng fire, nandun yung patient, no, na-inhale niya yung air, so yun. Namamaga yan sa loob, kaya nilalagyan ng artificial airway. Then we have also the endotrachea. From the word itself, endotrach, it means sa loob ng trachea. So that's why ginatawag siya endotrachea o ET tube. We have also nasal ET tube. Pwede siya sa nose, nasal area ipadaan. Then we have also the oral ET tube, no, or endotracheal tube. Most likely, endotracheal tube are used for patient na may mga severe condition, for operation, especially for general operation above the level of the abdomen. So, ginalagyan sila ng ET tube for ventilation. Patient in the ICU, yung mga patient na sinasabi natin na nilalagyan ng tubo, yon, mga newborn babies, na preterm babies, nilalagyan sila ng endotracheal tube. And also, severely ill patient, for example, patient with COVID-19, severe infection, so nilalagyan sila ng endotracheal tube. Then we have also tracheostomy. From the word itself, tracheostomy. Trachea means the trachea. Ostomy means bubutasan. So bubutasan yung trachea para lalagyan ng tube. Tracheostomy, guys, is intended for clients that is needed for long-term na artificial airways. Kagaya ng nangyari sa lola ko before, no, when she was admitted at the Tagum hospital, no, medical center. She was admitted in the ICU for about, I think, a month, 1 month or more. So because of the length of stay, and my grandmother needs to be intubated kasi severe infection kasi yan, no? UTI lang yung nag-start and then naging severe infection, naging septic, kaya ayun, nahihirapan na siyang huminga. Ang nangyari, the physician suggested of tracheostomy, no? Kasi tingin ng physician, matatagalan pa yung lola ko, no? Sobra, more than a month. So kasi disadvantage of endotracheal tube, guys, makakaroon ng damage yung sa oral niya, yung ipin niya, no, ngipin, no, masisira. Then sa oral area, sa voice box niya, na masisira. So kaya yon. But since of I have knowledge about this, guys, no, hindi ako pumayag, no, kasi pag once kasi tracheostomy, forever na kasi yan, no, I mean lifetime na yan. So mahirap, may butas dito, mahirap yan i-care eh. So hindi kami pumayag, but fortunately, guys, no, ang nangyari kasi yung mother ko pumunta na sa St. Peter, no, sabi niya sa taga St. Peter, pwede ba mag-inquire ganito ganyan. So sabi ng taga St. Peter, so saan na yung patay or dead body? So sabi ng mother ko, hindi pa man patay. Tumawa yung yung taga St. Peter, kasi daw pag ganun, matagal daw, pag ganun inunahan mo, hindi daw mamamatay yung patient. So fortunately, guys, no, ang nangyari, naka-recover yung lola ko. Yun, yun yung nangyayari. So hindi siya na tracheostomy or tracheostomy. So I think that would be all, guys. Do you have any question? May tanong ba related to our topic this morning? Do you have question? Follow-up questions, guys? Can you still hear me?
Yes, sir.
Yes, sir.
Yes po, sir.